Why does shape of my eyes differ a lot, leading to differences in size on both halves of the face? Please suggest if there is any other method to treat this problem, except surgery.
Thank you for your question. You've submitted two photos and you're asking why there is a difference between the shape of your eyes and your eyebrow from comparing one side to the other side of your face. And are looking for a solution other than surgery. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island, and I specialize in cosmetic surgery of the eyelids and face as well as the areas around the eyes. So certainly your situation is one that we come across a lot. The reality of the underlying issue has to do with the structure of the bone. Basically, the bone structure of your skull, one side is a little bit smaller than the other side. And this is more common than it is uncommon. In other words, people like to believe that symmetry is the norm. But the reality is that we're actually all asymmetric. One side is always a little bit different than the other. Now this becomes more accentuated as we get older. As we get older, people, and I'm not saying this necessarily applies to you, but as we get older, there's a loss of volume of bone, muscle, fat, soft tissue, and patients will often comment to me that they're frustrated that one eyebrow is lower than the other and that one nasolabial fold is deeper than the other. And it's a little bit of education to understand that when the bone structure is the way it is, then the soft tissue, the muscle, the fat, the skin, lays over the bones in a way that creates an appearance like yours. So when you look, if you were to ever do a CT scan, you might be able to see that where the shape of the eye socket may be a little bit smaller and it might be a little bit more back. So the bottom line with these types of situations is that there are limited surgical options because it really would require a considerable amount of surgery and probably not enough to make enough of a difference to justify that approach. In our practice, we have routinely, for people with facial aging, approach this in a way of essentially augmenting or enhancing the side that's a little bit weaker, such as adding volume in the cheek area. We use a method where we're actually placing the fillers at the deeper level of the structure of the face, on top of the bone, between the bone and the muscle. And by doing that, we're kind of creating the illusion of improved symmetry by adding volume on the area like the cheekbone. Now, the other approach also is to consider the artistic application of a drug like Botox. For example, if somebody's eyebrow is higher on one side compared to the other, well, there may be some value in either trying to lift an eyebrow a little bit using the Botox brow lift method, or to relax the eyebrow on the other side using Botox. So these are basically non-surgical options, but in a situation like yours, I'm not sure that there would be a significant benefit for you. I think that with the limitations of a photo and without a physical exam and being able to have you move your eyes and your eyebrows up and down, the chance to kind of see if it's feasible becomes somewhat limited. But for your own understanding, after submitting this question, understand that it's really bone structure. It's the natural structure of your face, and so chasing symmetry will be of limited success, but possibly in the future trying something that's safe and non-surgical may be a way to help you feel a little bit more symmetric in your appearance. So I hope that was helpful. I wish you the best of luck. Thank you for your question.